Hi everyone, Dr. David Kulla here with Synergy Wellness in New York City. Today we're going to do some cold laser therapy on Arian here, who has really tight traps and rotator cuff muscles. And he's got a lot of trigger points along here. So I'm going to show you how we melt away those trigger points with this incredible gadget. This is the MR5 Active Pro laser with stim. And this laser is unique because we're able to scan the area and look for areas of soft tissue inflammation or damage. So we're going to go ahead and start on the bad side. So you'll hear the laser beep right there when there's inflammation or soft tissue damage. So right in the cervical spine there. Tuck your chin down for me. So by having him tuck his chin down, I'm opening up the facet joints and getting the light through those facet joints, because the light does not necessarily go through bone, right? It'll go into the bone, and it does create bone growth, osteoblastic growth, but we're not trying to do that here. We're trying to get in and around the discs, the nerves, reduce any inflammation, and of course the muscles to reduce inflammation and muscle spasms. And it's going to tell us how long it's going to dose this spot, and then we're going to scan the whole trap muscle. And what I like to do sometimes is sandwich the whole shoulder area or upper trap area with two different lasers. We'll do that here in a minute. We'll get the other laser in, and that just speeds up the treatment times. And the nice thing about this laser is it can be turned from a 25 watt to a 50 watt, so it can be changed. And there we go, that's done dosing that area. And here we go. We're going to go ahead and scan the trap, looking for inflammation or soft tissue damage. And there we go, right over the AC joint. And again, it will beep when it's done dosing this area. We're going to go over that same spot that it found inflammation at. This laser here is a 25 watt, so the treatment times are a little bit longer, but it's just as effective. There's no difference except for the strength of the laser, 25 to 50 watt. It's just treatment times are a little bit longer. That's the only difference there. And then afterwards, we'll go ahead and palpate along the trap and see if he still has a lot of tenderness. And typically a shoulder, depending on whether it's a 25 watt versus a 50 watt laser, a 50 watt laser could probably do the whole top of the trap into the neck in 5 minutes, whereas a 25 watt laser might take 10 minutes to do the whole area. So I don't have the laser to scan his trap, but I know pretty much where he's inflamed. We scanned the top of the trap. We did not do the back of the trap where the supraspinatus is. So most people have a really inflamed supraspinatus. Most people have tendinitis in that supraspinatus muscle. Especially with working on a computer. If you're working on a computer and your elbow is away from your side, at least 10 degrees, then you're contracting this muscle up here, the supraspinatus muscle, and you're going to either develop tendinitis or just chronic neck pain with that. So because this is a 25 watt laser, we're going to leave this on for 2 minutes. We have 1 minute down so far. And this laser has several programs, and right now we're focusing on inflammation and pain relief, but and inhibition of the nerves. But after a few of those treatments, we increase the depth of the laser and lower the hertz to around 250, even all the way down to 50 or even 5. And that will penetrate deeper into the tissue. And instead of causing an inhibitory reaction, it's going to cause a stimulatory reaction and begin the process of healing and repairing the soft tissue. How are we doing so far? You probably don't feel a thing, do you?
No.
And how's that point now? Better?
Mm-hmm.
And this spot's tender too, I assume, right? Okay. So we're going to leave it on this last spot for 2 minutes. Yeah, if you've never used a laser before, folks, and you're watching this video, it's really something worth trying. If you've tried everything else, if you have disc herniation, spinal stenosis, any of these really chronic, difficult cases, and nothing's helping you, this is definitely worth trying. It has so many applications to it. It works for so many different things, not just soft tissue injuries. So it's worth trying at least a few times and to see what kind of results you would have. All right, we got one more minute here. How's that? Any tenderness?
A little bit.
Okay. And here?
Yeah, a little bit.
Okay. Got about 30 seconds here. And then we're just going to touch right up over here over the rest of that supraspinatus muscle into the AC joint. Okay, let's go ahead and check that trigger point. How's that feel?
That's 10.
Okay. Is it better than it was?
Yeah.
Okay, I'm going to do another minute on this spot. And because this is a 25 watt laser, he may need more than 2 minutes. He may need 3.5, 4 minutes even. Sometimes when there's a lot of inflammation under the tissue with a 50 watt laser, we may be on that spot for even longer than 2 minutes. But typically I do about 2 to 2.5 minutes for a 25 watt laser and about a minute to a minute and a half for a 50 watt laser. Take a couple deep breaths in and out. Just gonna finish up on these spots here, okay? So that's it, guys. Cold laser therapy for myofascial pain, muscle pain. This laser has so many applications. If you have any questions as to what it could be used for, or if you're not sure about something, certainly comment below in the video and we'd be happy to answer any questions you have about cold laser therapy as it relates to soft tissue. And we're gonna come out here and do the last spot. And how we doing in there? Better? And here? Still a little tender in here. This is a bad one, but it's better, correct?
Yeah.
If you guys have any questions about how cold laser can be applied to maybe your condition or the issue that you're having, don't hesitate to comment below. And I'd be happy to answer any questions that I can. Be patient. I will get to your questions. Just be patient, okay? Thank you everyone for tuning in, and Arian, thanks for letting us show everybody how this is done. Okay. All right, you're all set.